Menstruation is a sign that a woman's reproductive system has fully developed. The female reproductive system has a much more complex set of functions than that of a male, and so treating women's diseases is that much harder. Menstruation is an especially important index in gauging the female health. In the Orient, a woman is represented as the revolving moon or the changing seasons. This is unique to female physiological makeup. That is to say, menstruation is similar in principle to that of the changes of the moon and the tides. Furthermore, menstrual disorders are unexpectedly varied, and because individuals are different from one another, treatment can be very difficult. Today, we will observe the causes, treatments, and prevention of female menstrual disorders as seen through Oriental medicine. There are many ways to diagnose menstrual disorders besides the basic Oriental medical methods of looking, listening, asking, and feeling the pulse. Recently, the temperature gauging machine and Chuna therapy are used frequently in the diagnosis of menstrual disorders. As with other diseases, treatment should start with checking the condition of the patient's entire body. Could you please enlighten us on some of the causes of female menstrual disorders?
In Oriental medicine, 3 causes of menstrual disorders have been diagnosed. The first is a deterioration of the function of the entrails due to a deficiency of ghee and blood. Second, disease-causing agent, such as bacteria, which has entered the body, resulting in fever and inflammation. And the third is the poor circulation of ghee and blood due to lumping together of blood in the pelvis.
The treatment of menstrual disorders differs according to the type of disorder and the patient's constitution.
Herbal remedies for menstrual disorders take into account the causes of the disorder and the constitution of the patient. These remedies, called hyangbuja, are used when menstruation occurs sooner than usual. When there is a deficiency of blood and menstruation is late, sukji-hwang is used for treatment. When there are irregularities with the menstruation cycle, ingmo-cho is used for treatment. Ingmo-cho warms the body when it becomes cold due to these irregularities. When there are menstrual disorders due to defective development of the womb, umyeonggwak is used for treatment. This herb strengthens the muscles of the womb.
We've just observed herbal remedies for the treatment of menstrual disorders. Besides this, Oriental medicine can relieve the blocked portions of the meridian through acupuncture and warm the cold parts of the body through moxibustion. Moreover, cupping is used to refresh and improve blood circulation. And various exercises can also be used as treatment. Now, let's take a look at these various forms of treatment. Acupuncture works by strengthening areas where blockage has occurred. Acupuncture should be applied to the meridians that are related to menstruation. They are the meridians related to the liver and the meridians related to the kidney.
In order to relieve blocked ghee and blood, acupuncture is applied to 4 important points. This acupuncture point is known as 합곡혈, which is one of those 4 points. The 합곡혈 acupuncture point facilitates circulation of ghee around the body. Therefore, we apply acupuncture to this point first. It is located in the valley between the thumb and forefinger. One of the acupuncture points located in the liver meridian is the 대중혈. It plays an important role in relieving blocked ghee and is located between the first and second toes. Lastly, we apply acupuncture at the 삼음교혈, which is related to the womb. This point is used for the treatment of almost all female disorders.
Moxibustion works by warming cold areas and is thus used for women who have cold bodies. As with acupuncture, moxibustion is applied to the samumgyo area. Cupping is one method of relieving the lumping together of blood. When menstrual disorders arise due to the lumping together of blood in the regions related to the womb, a cup is attached to the region in order to pull the lump blood towards the surface of the skin to allow the blood to oxygenate. These areas within the bladder meridian are related to the kidneys. When cupping is used for poor blood circulation in this region, the skin bulges, swells, and turns a red color. Then, the lump blood can be replaced by fresh blood restoring circulation. If there is an obstruction of blood circulation in this region, a dark red color appears under the skin in the cup. Notice the dark red color that is surfaced in these regions which are related to the uterus, while over here the skin remains normal. This method, although it does not directly treat the uterus, is effective for the treatment of uterine disorders. There are many cases where menstrual disorders stem from abnormalities of the backbone, and a large percentage of patients have pelvic problems below the third vertebrae.
In this patient's case, start from the third vertebrae, the backbone is curved toward the left. Both sides of the pelvis are imbalanced. For this patient, in order to correct the pelvis, the neck must be corrected simultaneously. The first vertebrae of the neck bone must be simultaneously treated. This patient's right leg is slightly shorter than her left leg. In this case, the pelvis imbalance must be correct, but first a wedge-shaped block must be placed underneath the pelvis for 6 to 10 minutes to correct the problem. Because the neck also has abnormalities, the first vertebrae of the neck must be examined.
Menstruation is a psychological phenomenon that occurs on a regular basis and thus requires everyday maintenance and care. Traditionally, Oriental medical methods of preventing menstrual disorders involves the drinking of tea. Ginger tea is good for women who have cold hypersensitivity. Also, drinking tea made from ginseng, dates, ikmokcho, Chinese quince, or kugija, according to one's constitution, is good for prevention as well as the reproductive organs. Upon reaching puberty, one of the major changes a woman experiences is menstruation. Menstruation is the most important reproductive function for women. Thus, abnormalities in menstruation can lead to sterility and other various female disorders. Therefore, careful observation and attention to the body are necessary for all women. Until next time.